name is Angie Caton, and I'm here with the Takeda Oncology team, Jennifer Mann and Lisa Cruz, and we're bringing you a presentation about communicating with your healthcare team. Have you ever left?
I'm going to have you go back and we're going to repeat that.
All right.
Okay, stand by and
Repeat what?
hold on a minute.
The introduction.
Yes, please. I'm not seeing this. Do you see this? That's what I thought. Oh, there you go. Do you see it now?
Hello, my name is Angie Caton. I'm an oncology nurse, and I'm here with the Takeda Oncology team, Lisa Cruz and Jennifer Mann, and we're here to talk to you about communicating with your healthcare team. To get things started, and I know we're not in person, but just a quick poll. Have you ever left a medical appointment with a question that you wanted to ask, but didn't? Well, if you were in here with me, I'd know that you're not alone. I raised my hand too. We hope that this presentation will empower you to ask those questions and develop an open communication with your healthcare team. Like with most presentations, I want to let you know that we're going to be talking about the framework for an effective healthcare team, ideas for enhancing communication, and important topics to discuss with your healthcare team and questions to pose. Out of the deck, this is my favorite slide. Your healthcare team includes many types of medical and support professionals, and you are in the center like a hub and the healthcare providers as spokes. All these people work for you, and they share a common goal to provide you with the best possible care. So in my clinical practice as an oncology nurse for many years, I've got two to share with you, then one you might not even be aware of. So since I'm the nurse, I'm going to pick nurse and pharmacist. So behind the scenes, say you show up to my outpatient infusion clinic today at the hospital and you bring a list of home medications. Our pharmacist is going to review all those medications with your new medications that you'll be receiving in the clinic, just to make sure there are not any interactions or counter indications that, reasons why you should maybe not take it, or we should be watching out for something different for side effects. Another real common one that is real important would be like weight loss and fatigue. Say you showed up to my clinic, you get on the dreaded scale, but you've not gained weight, but you've maybe lost weight. So as your nurse, I'm going to ask you some more questions. I'm going to say, what's going on? Are you having trouble eating? You might say, I am so tired that I can't eat. I fall asleep. I don't feel like cooking. I don't feel like going to the store. My fatigue is an 8 out of 10. With 10 being the worst and 0 being no fatigue. And so I say, maybe it's time we engage someone else on the team. Would it be okay if I called the nutritionist and had the nutritionist talk to you about ways that you can increase calories, maybe with smaller amounts of food, or maybe there's different supplements or something that you might be able to take. And then maybe now is the time to engage a physical therapist, where it might help you build your strength and maybe you'll have less fatigue. And I might just make sure we review all those lab results with your oncologist to make sure you're not anemic and some of the fatigue is not coming from being anemic. But so you could see that, and I know that a lot of these others are fairly common to you in your healthcare team, but you can see where you might interact with them sometimes, always, or just on an as needed basis. By communicating with your healthcare team, you connect them with each other and provide them with the information you need. So when your nurse asks you what's your pain score from a 0 to 10, it's important to communicate that to them. Same thing with fatigue. or any other kind of measure or scale that they give you, because that would maybe indicate the need to pull in one of the other healthcare team members to help you get the best care possible. Why is this also important? It lays down a strong foundation for a strong relationship. So if you think about any of your personal and professional relationships, open communication is just the key to have those be very successful. 2, helps you get the best care for you. So the best care means the best protocol, or the best, I call them recipes, the best treatment. And it's a good analogy a lot of times if you think about it, because we have different types of cancers, and we have different cell types and different variants that are in our cancers that might have us taking different types of treatments than maybe our next door neighbor or friend that might have had the same type of cancer. But so communicating what you need it helps you get the best care. And then in turn, those first 2 steps helps the third step. It helps you get the best care available. So what's that team that we just showed with all those different spokes? If you don't communicate, and if we don't ask, and if you don't tell us, then we don't know to activate or to engage those other healthcare team members to provide that care for you. And then at each step of your journey, maybe even where you live, you don't have all those providers. And you might say, oh, there's not a geneticist at my facility, or there's not physical therapy readily, or nutritionists, readily available to help me, or navigator. We're going to talk about navigators in just a second too, but oncology nurses can help you, direct you, especially your nurse can be your best friend. There are some ideas that we have for enhancing communication. About 6 of them here. 1, bring a friend or a care partner. Now you might say, Angie, that has been very difficult since COVID. Places are not allowing family or friends in, and that was a really big challenge as nurses to try to communicate with care partners. It's been very difficult during the pandemic for our caregivers. But the best thing you could do is bring a friend. And if they can't come, you can maybe have them on Zoom, or maybe if you can ask permission to record the conversation with your healthcare provider. Pause. When I say pause, I mean when you hear something, or if you want to say something, kind of gather your thoughts, and from the information that you've heard, kind of plan on what you're going to say. And when you go to say it, speak slowly and calmly. And that's sometimes hard to do whenever we've heard some news, or maybe your doctor has given you a bit of information that you might not understand, or you might have understand it. You might not have explained it exactly in the way that you needed to hear it. So restate what you've heard. I think I heard you say that I have to have a scan once a week for the next 6 months. All right. And so that might have upset you when you heard that. And maybe that's not exactly what he meant, because we all sometimes misspeak. And again, just restating it lets them know what you've heard, what he said or she said, and then what you've heard. And you might ask them to slow down. Sometimes we speak very fast as healthcare providers. We have a lot to do, especially like in offices or in clinics, and we have other patients that we're trying to get to. Stay on time. Nobody's waiting. Ask them just to say, I'm sorry, but I didn't understand that. You're not making sense. That would be a good way to approach a healthcare provider, whether it's a nurse or a physician, and realize we have a language all on our own. And so we might say a word, you need a CTA ASAP. You're like, okay, what does that mean? Yes, a CAT scan, arteriogram as soon as possible. And so we didn't say that. We said, I'm going to order a CTA ASAP. So you say, hey, well, sorry, I didn't understand what you just said. And they might assume that you understood, and we just sometimes don't even understand that we're saying these words and using these acronyms. and repeat back to your healthcare practitioner or provider what you think they've just said. In nursing, we call it teach back. Nurses are supposed to, when they give you education, they're supposed to say, okay, so tell me what, I'm going to give you an example. You've taken a chemotherapy drug that might lower your blood counts. And it's very important for you to call or come to the emergency room if you're running a fever. And so I give you that education. And so what I might say to you, all right, so tell me, what are you going to do if you're at home on a Friday night with the temperature of 101? And so then it would like throw a real life scenario in there. And no, you're not going to take 2 Tylenol and call the doctor in the morning. You are going to get yourself to the emergency room because your white count might be low and it could be a life-threatening situation. So nurses should use that, but you can use it back on your physician or your other healthcare team provider, just to make sure that they've understood what you've said. So these are things that your healthcare team wants to know about you. And you might say, really? And it is true. We want to know these things. We want to develop a relationship with you. Makes it easier for us to care for you. And we want to come to a level with you that we understand you and what you need and to better help you. Tell us about your culture, education, and medical knowledge. Yesterday, we sat with people that were in the medical field that were care partners. It's very important to know if the care partner team in the medical field, they might have a greater understanding. Maybe you can use different terms, or maybe you can use different explanations. Or is this the first experience you've had with the healthcare system? Healthcare systems are extremely complicated, and I don't have to tell this audience that. And if it's your first time in it, you know how it felt the first time you went to a physician with your cancer diagnosis. Your spiritual and other beliefs. So what holidays are important to you? Or do you have other spiritual observances? Do you take blood or blood products? Do you not eat pork? Those are very important for us to know. Your social life. Do you cycle, hike, shop, do crafts? Where do you like to go on vacation? What's important for you? The role of a care partner or the absence of them. So we're not always lucky to have a care partner with us 100% of the time. Sometimes they have to work or do other things. But so if you have a care partner, let them know, and let them know when are they available. Are they available all the time? Do you live with them? Can you call them? Or do you not have someone that's in your life at all the time? Work considerations. Do you work for your benefits? Do you have a flexible work schedule? Do you have to work? A lot of us have to work. I came in contact with a patient that works every day, 7 to 3 I'm from the South, so Waffle House. If you're not familiar with the Waffle House, she works at a Waffle House 7 to 3 every single day of the week. And people were trying to make appointments and they were like, we can't get in touch with her. We can't get in touch with her. She can't bring her phone in the restaurant. So you have to call her after 3. So once we communicated those kind of things to her, things were better for her. Your financial situation. Financial toxicity is a big thing for anybody with a chronic illness. What is your insurance status? Do you have insurance? Do you have difficult copays? Do you have to have pre-certs? Those are all important things for us to know. Your living conditions or family obligations. Do you have an apartment with stairs? Do you live in a rural area? If you live in a rural area, you need to have prescriptions at your house, because if it takes 45 minutes to find a pharmacy in the nearest town, it's kind of hard to do that in the middle of the night. Whether you are a care partner or for someone else. So what I mean by that is that do you have small children? Do you have adult children that you care for? Do you have a spouse that has chronic conditions that we need to know if you are in the role of a care partner and now that you need care partners? Your hopes and worries. So when I talk about hopes, let them know what you hope for. Let them know that hope changes, and tell them, I like to say, the rock in your shoe. So if we've all had maybe a pebble or something in our shoe, it's not life ending, but it just bothers you a lot. So let them know, when appointments are late, or if you don't get calls back soon, or whatever bothers you, let people know. What matters most in your life? Do you want to live long and prosper? Think about that. We all want to live long and prosper, but is it quality? Do you want to have symptom free, or do you want to have long life? Your thoughts on palliative care. Now, I didn't introduce myself about my palliative care experience, but besides an oncology nurse, I'm also certified in hospice and palliative care. And palliative care is a medical specialty, and you might confuse it sometimes with hospice, but it can be very helpful to someone with a lung cancer diagnosis. It can help with many things like pain and shortness of breath and depression, and it could also help your family members and relationships. Remember that if you engage palliative care, you're a member of two teams. You've got the treatment team, and then you'll have your palliative care team that's just focused purely on symptoms that you might be experiencing. It's never too early to start. It's a part of hospice. So I'm going to use my hands a little bit. So you have hospice as the whole, and palliative care is in there. So palliative care is its own standalone specialty, and it can help you so much in symptom relief. And that helps us in our quality and our quantity of life. Some suggested questions. Are there support services like navigators and social workers? It may not be available in your area, especially in a rural area or a smaller hospital, but ask, and they might be able to refer you to like services. Remember that there might be other treatments than the one the doctors have suggested. Each treatment might have several different options, and many have different benefits and different risks. Those are important to know so you can make an informed decision. Are there written materials that you can take home or websites that you could visit? My best advice to you is to only go to websites recommended by your healthcare team. Do I need to see other doctors or health professionals? They will engage you on a regular basis, probably with, nutritionists and maybe the radiation oncologist, but you'll probably need to see more than just one in your healthcare journey. When do I see you again? How often are my follow-ups? Do you need to kind of be mentally prepared for every 3 months, every 2 months, how does that go? And then who is the best person to contact with questions? What happens on that Friday night at 6 o'clock? That come up before my next appointment. Patient portals are very good. And that's another tidbit I'd like to empower you with. Patient portals. Use them if you have them. Sign up. I know it might seem sometimes a little irritating to get the text messages and stuff from them, but that's how most physicians and nurses communicate with their patients. Phone calls are not always the best. They get in a big, long phone tree, and then the nurse has to listen to a bunch of them. And then triage them from there, but they go to the right person at the right time when you use the portal or email through the portal. So we're coming to the end. So what's one question you're going to ask a member of your healthcare team the next time you see them? All right. If you just think about that, if you've thought a little bit about what we've said, and then hopefully the next time you'll go prepared, and that you'll have some of these other ideas about what to ask. You will receive a survey by email, or you can click this right now if you'd like to scan, and a one-page informational handout that gives you all the points that we just talked about. I'd like to thank you so much for coming today. We're honored to be attending this program with you, and thank you for taking the time to attend this session.